When you ablate right posterior PV antrum, you can imagine the catheter contact direction because transseptal side and your target site, right posterior antrum, is almost perpendicular direction. So it is very difficult to make a good contact. If you push a little bit, the contact pressure is too high. If you pull back your catheter a little bit, the contact became very poor. So it is very important to push and pull back your catheter continuously and make a better contact. And also, this area contact with posterior wall, posterior mediastinum, patient complain pain quite often. So please give enough time to ablate the right side, posterior side antrum ablation. Okay, so some patient has a very folded structure in this area, which means the vertebra, aorta, or some other structure pushing the posterior wall. In those patients, if you push the catheter too much, patient always complain pain and hard to ablate. So in this area, you need to rotate your fluoroscopy to aerial view and comparing the angiogram you took before and where is the PVI ostium area. Because the musculature of inferior pulmonary vein, both sides, the inferior pulmonary vein is very shallow. If you give a high power burn, slightly deep side, you have a high risk, high chance to generate the PV stenosis. So always check the aerial view and confirm where is your catheter tip, comparing the angiogram imaging. This part is easy and safe area, the septal aspects of right side pulmonary vein. But if you generate transseptal puncture to posterior to high side, sometimes it is difficult to ablate this area. Because the transseptal hole is here, it's hard to make a good contact. So in this point, you need to rotate your catheter and sheath clockwise altogether. And please make sure your sheath is inside of the transseptal side. Sometimes the sheath is outside of left atrium, only catheter is inside. In that case, even though you rotate the sheath vigorously, you can make a good contact. Catheter tip move away from the endocardial surface. This is the easiest part, and this is also important part. Carina, anterior and posterior carina of a right side pulmonary vein is important point. You need to give enough burn. Root part of right side pulmonary vein is also difficult, one of the difficult parts during PVI isolation. And I usually try to push the catheter highest point and ablate more, but make sure your catheter tip location is proper or not. Because catheter is straight forward the roof of endocardial surface, and the temperature tip is a little away from the catheter tip, and sometimes it's high risk of tamponade in this area. So don't push too much in this position. It's very dangerous. Okay, so this sphere suggests the impedance dropping and the location of ablation site. It is quite useful for the safety. I don't trust the color change 100%, but at least if the color change to chocolate color, that means that there's some lesion formation, and if you give more energy, it has a risk of complication. And actually, the rooftop is here. This area is rooftop of right side pulmonary vein. So I push the catheter inside the pulmonary vein, curve down, and rotate sheath, make this second curve, S curve, and push the sheath gently and make a good contact and fill up the roof side. Even though in this point, the patient respirates vigorously, catheter stability may change, but take your time and give RF energy, sophisticated technique, and fill up all the gaps, and finally successfully generated right side antrum ablation. And the same way to the left side antrum ablation, I give a carina ablation with 30 watt, and watching the signal, ablation signal inside. If there is no signal, I move fast. If there is signal, I give a little more energy to confirm the antrum ablation was successful or not.